There's something deeply unsettling about the moment you realize that a part of your body you never thought to worry about is quietly under threat. Not because of something dramatic, no accident, no sudden injury, but because of a condition that had been living inside you for years, slowly rewriting the rules of how your body functions. That realization hit me not in a doctor's office, not during some kind of health crisis, but on an ordinary Tuesday morning, when I sat down to read the news and noticed that the words on the screen looked slightly softer than they should. Not blurry exactly, just less sharp than I remembered them being. I told myself it was tiredness. I told myself it was the screen brightness, maybe the angle of the light coming through the window. I made every excuse a person makes when they sense something is wrong, but aren't quite ready to face it. And I think that's where so many of us live, in that space between noticing and acknowledging. It's a comfortable space, right up until it isn't. What I didn't know then, and what I want you to understand before anything else, is that the eyes are one of the earliest places the body shows the consequences of uncontrolled blood sugar. Long before most people receive any kind of diagnosis or warning, the tiny, delicate blood vessels inside the eyes are already responding to elevated glucose levels. They're swelling, they're weakening, they're quietly beginning to leak. And the terrifying thing about this process is that for a long time, it produces no pain whatsoever. Vision changes can be subtle enough that you explain them away for months, sometimes years, before anyone connects the dots. I had been living with type 2 diabetes for about 4 years when the vision changes started. My numbers weren't catastrophic. I wasn't in crisis mode, or so I thought. I was managing things, taking my medication most of the time, watching what I ate mostly, checking in with my doctor every few months. By every conventional measure, I was a reasonably compliant patient. But compliance, I would learn, is not the same as truly understanding what is happening inside your body. And without that understanding, you can do everything you're told and still miss the things that matter most. The morning I finally decided to stop making excuses, I was driving to the grocery store and noticed that the traffic light ahead looked like it had a faint halo around it. A soft glow that shouldn't have been there. I blinked. It was still there. I drove home, called my optometrist, and made an appointment for the following week. That appointment changed everything. My optometrist referred me to a specialist, an ophthalmologist who worked specifically with diabetic patients. And it was through him that I began to truly understand what my diabetes had been doing to my eyes. His name was Dr. Ethan Walker, and he had a way of explaining complex things that made you feel informed rather than frightened. The first thing he told me was something that I think everyone living with diabetes needs to hear clearly. The eyes have their own vascular system, and that system is extraordinarily vulnerable to the effects of high blood sugar. He explained it to me like this. Inside the back of each eye sits the retina, a thin layer of tissue that functions essentially like the film in an old camera. It captures light, converts it into electrical signals, and sends those signals to the brain, which then assembles them into the images we see. The retina is supplied by a dense network of tiny blood vessels, some of the smallest in the entire human body. And those vessels, because of their size and their constant workload, are among the first casualties of prolonged elevated blood glucose. When blood sugar stays too high for too long, the walls of these vessels begin to deteriorate. They become fragile. They swell. They can develop small bulges called microaneurysms, and eventually they begin to leak fluid and blood into the retinal tissue. This is the beginning of a condition called diabetic retinopathy. And Dr. Walker told me, with a kind of quiet urgency that I've never forgotten, that it is the leading cause of new blindness in working-age adults around the world. Not an obscure condition, not something rare. One of the most common causes of preventable vision loss on the planet, and most people don't learn about it until they're already experiencing it. What made this even more sobering was learning how the progression works. In the early stages, known as non-proliferative diabetic retinopathy, the damage is happening, but the visual symptoms are minimal. You might notice occasional blurring. You might have days where your vision seems slightly different than it did the day before. Sharper in the morning, cloudier in the afternoon. You might see small floaters drifting across your field of vision. These things are easy to dismiss. Most people do dismiss them. But meanwhile, beneath the surface, the damage accumulates. As the condition advances, the retina begins to send distress signals, starved of adequate oxygen and nutrition, because the damaged vessels can no longer deliver them properly. The retina essentially tries to compensate by growing new blood vessels. This sounds helpful, but it isn't. These new vessels are abnormal. They're fragile and prone to bleeding. They can grow into the vitreous, the gel-like substance that fills the eye. And when they rupture, the resulting bleed can cause sudden, dramatic vision loss. This advanced stage is called proliferative diabetic retinopathy, and it is where irreversible damage becomes a very real risk. Dr. Walker also told me about diabetic macular edema, which is another complication that can occur alongside retinopathy. The macula is the central part of the retina, responsible for the fine, detailed vision you use for reading, recognizing faces, and seeing color. When fluid leaks into the macula from damaged blood vessels, it swells, and that swelling directly impairs the precise vision you depend on for nearly every daily task. It can happen at any stage of diabetic retinopathy, which means even patients in the early phases are not protected from serious vision impairment. For those who want to better understand how to improve vision, reduce blurry sight, and discover habits that help protect eye health over time, we left a complete guide in the first link in the description. It expands naturally on everything we are discussing here. Sitting in that exam chair, absorbing all of this information, I kept coming back to one thought. Why hadn't anyone told me this sooner? Not in the vague checkbox way that sometimes happens in routine appointments. Make sure you see an eye doctor once a year. But in the real, concrete, this is what is actually happening inside your body way that Dr. Walker was now explaining to me. Because knowing the mechanism changes everything. When you understand why something matters, you stop treating it like an obligation and start treating it like a priority. The good news, and there is significant good news here, is that diabetic eye disease is largely preventable, and even when it has begun, early intervention can be remarkably effective. The single most powerful thing a person with diabetes can do for their eye health is maintain consistent, well-managed blood glucose levels over time. This isn't just about hitting a target number on any given day, it's about reducing the cumulative exposure of those tiny retinal vessels to the damaging effects of excess sugar. Studies consistently show that tight glycemic control substantially reduces the risk of developing retinopathy and slows its progression in those who already have early signs of it. Blood pressure management is equally critical and frequently underemphasized. High blood pressure compounds vascular damage throughout the body, including in the eyes. Many people with type 2 diabetes also have hypertension, and the combination significantly accelerates the deterioration of retinal blood vessels. Keeping blood pressure within a healthy range through diet, exercise, medication if necessary, and stress management is a direct investment in your vision. Diet plays a role that extends beyond blood sugar control. Foods rich in antioxidants, leafy greens, colorful vegetables, berries, and foods containing lutein and zeaxanthin actively support the health of retinal tissue. These compounds help neutralize oxidative stress, which is one of the key mechanisms through which high blood sugar damages the eyes. Omega-3 fatty acids found in fatty fish and certain seeds have been associated with reduced inflammation in ocular tissues. Vitamins C and E, zinc, and certain B vitamins all contribute to the maintenance of healthy vascular and nerve function in the eye. Regular comprehensive eye exams, dilated eye exams specifically, are non-negotiable for anyone living with diabetes. Standard vision checks at an optometrist do not adequately examine the retina. A dilated exam, in which drops are used to widen the pupil so the specialist can see the entire retina clearly, is the only way to detect early signs of diabetic retinopathy before symptoms appear. Many guidelines recommend annual dilated eye exams for people with diabetes, and more frequent exams if any changes have already been detected. I want to pause here and say something directly to you, because I think it matters. The fact that you're watching this, that you're seeking information and trying to understand already puts you ahead of where I was when this all began for me. Awareness is the foundation of prevention. You cannot protect something you don't understand, and you cannot act on warnings you've never received. If you want to learn practical ways to maintain good vision, avoid cataracts, and discover which vitamins help support your eye health, we placed a simple guide in the first link in the description that summarizes everything in a clear and practical way. My own journey since that appointment with Dr. Walker has been one of consistent recalibration. I adjusted my diet with more intention. I became diligent about my glucose monitoring. I stopped skipping my blood pressure medication. I started seeing my ophthalmologist every 6 months instead of once a year. And gradually the halos around streetlights faded. The morning blurring that I had normalized became less frequent. My retinal scans have shown no progression in the 2 years since. That's not a cure. I am still a person living with diabetes, and I will be for the rest of my life. But it's evidence that action works. The relationship between diabetes and vision is one of the clearest examples I know of how connected everything in the body truly is. It's a reminder that no condition operates in isolation, that the choices we make every day ripple outward into systems we might never think to pay attention to, until we have to. The eyes don't announce their distress loudly. They whisper it in soft edges and fading contrast and colors that don't quite look the way you remember. Learning to listen to those whispers and knowing what they might mean is one of the most important things any of us can do. If this story resonated with you, if you recognize yourself in any part of it, or if you've been carrying quiet concerns about your own vision or someone you love, I want to invite you to subscribe to this channel. Every week we bring you content like this, honest, human, research-informed stories about real health challenges that affect real people. Stories that don't talk down to you, don't panic you, but give you the knowledge and the language to take better care of yourself. Subscribe, share this with someone who needs to hear it, and come back for the next chapter. There's always more to learn, and you don't have to learn it alone.